10 signs your parent might not have much time left, and how to help them. Watching a parent age is one of the hardest realities of life. But losing a parent is the hardest experience in life. No matter how old we are, we never feel ready to say goodbye. But sometimes there are subtle signs that the end is near, changes in their body, their behavior, and even the way they interact with loved ones. Recognizing these warning signs can help you prepare emotionally, offer the right support, and make their final days as comfortable and meaningful as possible. In this series, we will go through 10 key signs that a parent may be nearing the end of life, and most importantly, what you can do to help them through this time. Let's start with the first sign, a noticeable drop in energy and weakness. One of the earliest and most obvious signs is a dramatic decrease in energy levels. Your parent may sleep much more than usual, sometimes up to 16 to 20 hours a day, struggle with simple tasks like walking, getting dressed, or even speaking for long periods, feel physically weak, often saying things like, "I'm just so tired," or "I don't have the strength." Why this happens? As the body prepares for final stages of life, it begins to slow down, using energy only for essential functions. The heart beats slower, circulation weakens, and organs work less efficiently. This leads to constant fatigue and extreme weakness. How you can help: allow rest and encourage them to sleep as much as needed without making them feel guilty for being tired. Simplify daily activities by helping them with dressing, eating, and moving around, but let them do what they can to maintain independence. Speak gently and be present. When they're awake, sit with them, hold their hand, and talk softly. Adjust their diet by offering small, nutrient-rich meals or soft foods if they have trouble eating. Most importantly, be patient. Your parent isn't being lazy. Their body is simply conserving energy for what's ahead. Sign 2, loss of appetite and weight loss. One of the most common signs that a parent may be approaching the end of life is a noticeable decrease in appetite. They may eat significantly less or refuse meals altogether, show little interest in favorite foods they once enjoyed, struggle with chewing or swallowing, lose weight rapidly, even without trying. Why this happens? As the body starts shutting down, it no longer needs as much fuel to function. The digestive system slows, and the brain signals that eating is no longer a priority. This can be difficult to witness, especially for loved ones who want to nourish and care for them. How you can help: avoid forcing food. It's natural to want them to eat, but pressuring them can cause distress. Instead, offer small, easy-to-digest portions like soup, pudding, or smoothies. Keep them hydrated. Even if they refuse food, encourage small sips of water, tea, or ice chips to prevent dehydration. Make mealtime comfortable. If they struggle with chewing or swallowing, try softer foods or liquid meal replacements. Focus on quality, not quantity. If they only want a few bites of something, let them enjoy whatever appeals to them, even if it's just a spoonful of ice cream or a sip of juice. This stage is emotionally challenging, but understanding that appetite loss is a natural part of the process can help you provide better care and comfort. Sign 3, increase fatigue and sleeping more. If your parent starts sleeping significantly more than usual, it may be a sign that their body is conserving energy as it begins to slow down. They might sleep for most of the day and seem difficult to wake. Feel exhausted even after short conversations or minimal activity. Struggle to stay alert, often appearing drowsy or disoriented. Why this happens? As the body weakens, it prioritizes essential functions, leading to a drop in physical and mental energy. The heart and lungs may not be supplying oxygen as efficiently, which makes even small tasks exhausting. How you can help: let them rest. Don't force them to stay awake or active if they are too tired. Their body knows what it needs. Provide comfort. Make sure their bed is comfortable. Adjust pillows for better breathing and keep noise levels low. Engage gently. If they're awake, speak softly, hold their hand, or play soothing music. Even if they don't respond, they may still feel your presence. Sign 4, withdraw from family and friends. Your parent may begin withdrawing from social interactions, even with their closest loved ones. They might speak less or show little interest in conversations, seem distant or emotionally detached, prefer to be alone, even when family visits. Why this happens? This is often a sign that they are beginning to turn inward and prepare for the transition. It doesn't necessarily mean they don't love or appreciate their family. It's just a natural shift in focus. How you can help: respect their space. Don't take their withdrawal personally. Give them time alone if that's what they prefer. Be present without pressure. Sit with them in silence if they don't want to talk. Your presence is still comforting. Speak with love. Even if they don't respond much, gently telling them you love them or reminiscing about happy memories can bring them peace. Sign 5. Changes in breathing patterns. As the body begins shutting down, breathing patterns may change. You may notice periods of rapid breathing followed by long pauses, called Shane-Stokes breathing, shallow or labored breathing, a gurgling or rattling sound in the throat due to fluid buildup. Why this happens: the body no longer regulates breathing the same way, and congestion can build up in the lungs. This can be distressing for loved ones to hear, but it is usually not painful for the person experiencing it. How you can help: keep them comfortable. Prop them up with pillows to make breathing easier. Use a humidifier. Moist air can help ease breathing difficulties. Stay calm. These changes can be unsettling, but panic may make them more anxious. Hold their hand. Speak soothingly and reassure them. Sign 6. Changes in skin color and body temperature. As circulation slows, their skin may change in color or feel different. They may have cold hands and feet, develop a bluish or purplish tint on fingers, toes, or lips, feel clammy or sweaty even if the room is cool. Why this happens: the body is prioritizing blood flow to vital organs, causing less circulation to the limbs. This is a common part of the dying process. How you can help: keep them warm with blankets. Avoid using heating pads, as their skin may be more sensitive. Adjust room temperature for comfort. Offer gentle touch. Holding their hand or lightly rubbing their arm can provide comfort, even if they don't react. Sign 7. Increase confusion and hallucinations. Your parent may experience confusion or see things that aren't there. They might forget where they are or who people are. Talk about seeing deceased loved ones. Appear anxious or restless. Why this happens: the brain receives less oxygen, which can lead to disorientation. Some believe that seeing deceased loved ones is part of the transition process, bringing comfort in the final days. How you can help: stay patient and reassuring. Don't argue or correct them if they seem confused. Listen with kindness. If they talk about seeing people who have passed, acknowledge it rather than dismiss it. Keep the environment calm. Minimize loud noises and sudden changes to prevent distress. Sign 8. Reduce urine output and digestive changes. Your parent may have less need to use the bathroom as their body processes slow down. They may urinate less frequently or have dark, concentrated urine, experience constipation, or stop having bowel movements. Lose control of their bladder or bowels in the final hours. Why this happens: the kidneys and digestive system are shutting down as the body prepares for the end. How you can help: use incontinence pads or briefs. This helps keep them clean and comfortable. Keep them hydrated as much as they'll accept. Even a few sips of water can help. Reassure them. If accidents happen, don't make them feel embarrassed. Offer gentle care. Sign 9. Unusual restlessness or agitation. Some people become restless or seem to fidget constantly. This might include picking at sheets or clothing, moving their hands as if grabbing at something unseen, showing signs of distress despite no obvious pain. Why this happens: this could be due to changes in brain function, discomfort, or emotional processing of the transition. How you can help: talk to a doctor. Medication may help ease distress if they seem very agitated. Provide a calm presence. Speak softly. Hold their hand and reassure them. Play soft music or use gentle lighting. This can create a peaceful atmosphere. Sign 10. A final burst of energy. Sometimes, a person near the end will suddenly seem more alert, talkative, or energetic after days of being unresponsive. They may wake up and talk clearly, ask for their favorite meal, or express love to family. Appear more like their old self for a brief time. Why this happens. This is known as terminal lucidity. While it may feel like they're improving, it's often the body's last surge of energy before shutting down completely. How you can help. Embrace the moment. If they want to talk, listen and cherish it. Say what you need to say. This may be the last opportunity to express love or closure. Be prepared. This burst of energy is usually followed by rapid decline. Stay close and offer comfort. Final thoughts. How to support your parent in their last days. Watching a parent decline is one of the hardest experiences in life, but understanding the signs can help you provide comfort rather than fear. Be present. Even if they don't respond, your presence matters. Speak with love. Hearing is one of the last senses to fade. Tell them what's in your heart. Let go of expectations. Every journey is unique. Accept the process and focus on making them comfortable. This is a time to honor their life, express love, and find peace in the moments you share. Even though saying goodbye is painful, your care and presence can bring them the comfort they need in their final journey. Watching a parent decline is one of the hardest experiences in life, but understanding the signs can help you provide comfort rather than fear. Be present. Even if they don't respond, your presence matters. Speak with love. Hearing is one of the last senses to fade. Tell them what's in your heart. Let go of expectations. Every journey is unique. Accept the process and focus on making them comfortable. This is a time to honor their life, express love, and find peace in the moments you share. Even though saying goodbye is painful, your care and presence can bring them the comfort they need in their final journey. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more insights and support on navigating life's toughest moments. Turn on notifications so you never miss an update. Your support helps us continue creating meaningful content. Thank you for watching.